Hello, my name's Allysa Ballantini. I'm a registered dietitian at MercyOne Bariatric Surgery and MercyOne Weight Loss and Nutrition Center. Today, we're going to talk about our services that we offer, both surgical and non-surgical. So we'll start with surgery. Bariatric surgery, also known as weight loss surgery, is any procedure intended to reduce weight in patients with morbid obesity. Bariatric surgery procedures are classified as restrictive, meaning a reduced stomach size, limiting the amount a patient may comfortably eat at any given time, or malabsorptive, from alterations to the small intestine length intended to inhibit caloric absorption. Procedures may be primarily restrictive, such as the vertical sleeve gastrectomy and the laparoscopic adjustable gastric band, malabsorptive, like the biliopancreatic diversion with duodenal switch, or both restrictive and malabsorptive, like the Roux-en-Y gastric bypass. The use of adjustable gastric bands continues to decrease. Some undesirable features of the adjustable gastric band are poor weight loss, and patients may require surgery for removal in the event of a band slip, dysphagia with or without distal esophageal dilation, or esophageal motility disorders. Our program removes bands and offers alternatives to patients who have complications with their bands. Our bariatric surgery program performs the Roux-en-Y gastric bypass and the vertical sleeve gastrectomy. Patients with morbid obesity are afflicted with high relapse rates following medical weight loss and diet programs. Bariatric surgery is highly effective at attaining substantial weight loss over the first 1 to 2 years postoperatively, but many studies have also proven its effects are sustainable over a decade or longer. Roux-en-Y gastric bypass patients average about 60% excess body weight loss, and sleeve patients average nearly 55% at 10 years. Remission of diabetes may occur within days of the bypass, and in both the sleeve and bypass patients, a diabetes remission rate of approximately 80% is common more than 10 years postoperatively. It is well established that surgery is often the only definitive treatment for patients with morbid obesity and is particularly effective for patients who are 100 or more pounds overweight with comorbidities such as obstructive sleep apnea, diabetes mellitus, hypertension, and hyperlipidemia. The MercyOne Bariatric Surgery Program is monitored by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Plan. They are the accrediting body for bariatric surgery centers of excellence. Each level of accredited centers performs within a certain facility volume, patient age range, with specific required standards and outcomes. Bariatric surgery centers like ours at MercyOne utilize an interdisciplinary team to evaluate patients for suitability and educate them on the lifelong changes that must be implemented to be successful following surgery. Our patients must comply with strict dietary and exercise recommendations. This team consists of mental health professionals, exercise specialists, dietitians, a bariatrician, internist, pharmacists, primary care providers, a physician assistant, and nurses. They all work with the program director to guide therapy and monitoring of patients within our center. If you have questions about bariatric patients or wish to refer someone to our program, please give us a call. We will talk about the referral process later on as well. So our MercyOne Weight Loss and Nutrition Center is focused on non-surgical options for our patients. The MercyOne Weight Loss and Nutrition Center office is located within the MercyOne Health and Fitness Center in Clive. One of the programs that we offer are called Focused Nutrition Sessions, where your patients meet with registered and licensed dietitians. We have 5 dietitians that meet with patients Monday through Thursday. During these appointments, your patients meet with a dietitian to review their food and nutrition history and discuss specific health conditions related to diseases, weight management, sports nutrition, pediatric nutrition, or general healthy eating. Some patients like to meet with dietitians on a routine basis. Dietitian appointments it is not required to have a referral for dietitian appointments, but they are welcome. We have several patients call us and do a self-referral, but we also receive several referrals from providers. These appointments are cash pay only. The first appointment is $80 and a follow-up appointment is $60. Patients are encouraged to use their flex spending if available. Our next non-surgical option is called medical weight loss visits with Dr. Kara Thompson. Dr. Thompson is an obesity certified physician, and this is an extension of primary care. During visits, Dr. Thompson meets with patients and reviews their medical history, medications, and their exercise habits. She creates a personalized action plan, setting goals for nutrition, physical activity, tracking, ways to decrease hunger and craving. Medical management is available for those that qualify. Some patients choose to explore the medical management route. Others like to meet with Dr. Thompson for accountability. She visits with patients every 3 to 6 weeks for follow-up. Patients are expected to contact their health insurance company to verify that they have obesity management coverage prior to their first appointment. Several of our patients choose to meet with Dr. Thompson for medical weight loss visits and meet with a registered dietitian for focused nutrition sessions for more support and accountability. This is definitely an option that we can discuss with your patient. Lastly, we do offer MercyOne, A Path to a Healthier You, which is our meal replacement and behavior change program. Brenda will highlight this in a little bit. I wanted to discuss our referral process a little bit. We welcome referrals. Some of our patients find that they are referred to us via AEHR or a fax. Some providers reach out to us via telephone. That's fine as well. Our fax number is 515-358-9420. Also, like I mentioned, AEHR is a fine way to send a referral. For patients that are strictly interested in bariatric surgery, providers sometimes will send referrals, which is fine. We will contact them. But also, patients can be directed to the MercyOne bariatric surgery website, and they can complete the initial required steps, such as the community lecture and the health history questionnaire. When we get a referral, we will contact your patient and discuss the option of setting up a wellness coordinator appointment, where your patient will meet with a wellness coordinator to discuss their goals and our services to figure out what service might be the best fit for them. These appointments can be done in office at our location in Clive or via telephone. The appointments can last anywhere from 20 to 45 minutes, depending on the questions and information the patient is looking for. Any questions, please feel free to call us. Our phone number is 515-358-9400. Otherwise, I thank you for your time. And now Brenda will highlight the MercyOne, A Path to a Healthier You service that we offer to your patient.
I'm Brenda. I'm a nurse with MercyOne, in the non-surgical area of weight loss. And it's my privilege this morning to tell you a little bit about our medical weight loss program that entails a behavior portion and a meal replacement portion. And that's called the MAP program for MercyOne's A Path to a Healthier You, the behavioral change program. It takes a lot of courage for someone to come into a program and ask for help. And we try very much to be a very personalized clinic and to treat people as a whole person, not as a disease process or someone with obesity. So we do a lot to make them feel comfortable when they come in. MercyOne, A Path to a Healthier You, recognizes that obesity is a complex chronic disease. Sure, it has genetic and social and emotional and environmental causes, but each person should feel that individualized touch when they come in. We want to treat the behavioral aspects as well as the medically related conditions of obesity. We want to provide the support to help people identify the factors, root cause analysis, that contributes to their weight gain and helps them to make change with those particular factors that they identify. Typical patient coming into our clinic has a BMI greater than 25, obviously. They are overweight. They are usually very highly committed because of that courage factor that they've dealt with to walk through our doors. Often they're coming in because they themselves have some health conditions related to obesity, such as heart disease, diabetes, sleep apnea, joint pain, arthritis, or we're seeing people that are coming in younger that haven't experienced those diseases quite yet that want to prevent that. Oftentimes they're caregivers to older family members. So they're realizing the need for some preventative health, and a wellness journey has become a goal for them. We do take a multidisciplinary approach, and as you probably know, there are 4 components that if these 4 components don't fit together in one program, the likelihood of continued success for a lifetime is less. And those 4 components are medical monitoring, number 1, because a lot of our patients come in with a multitude of medications. They're managing diabetes or they're managing a heart condition already with specific medications. The second component is a full meal replacement diet. We have been in the business long enough to know that you can augment the food and try to make the food behave, and then we return to old habits thinking that we can handle table food. And so we do take a very strict approach with a meal replacement program for about 4 weeks, a high protein, lower carb intake. We could talk about the product later. The third component of our multidisciplinary approach is behavior modification. We do weekly phone calls from a behavioral specialist, and that tends to be a very significant part of our program because that counselor one-on-one having addictive counseling experience really helps each person to identify those individual behavioral habits, some family culture, some stress factors, and all the things that we know go into our emotional and social being. And he helps them to move through looking at food differently. The fourth and obvious final component is that nutrition and exercise education. We're very proud to say we have excellent registered dietitians in our program that meet with our patients weekly and help them to take that food supplement program and transition back into table food and what that healthy part of their next journey looks like. The goals and the health benefits are numerous. First, the things that we like to see go down more than the scale even sometimes is a reduction in their blood lipids. We do some lab work up front to determine kind of where they're at if they've not had that already taken care of with their primary care provider. We want to see a decrease in blood pressure, and we also want to see a decrease in the scale, but the one thing that we want to see go up is an improved blood glucose control. So bringing that hemoglobin A1C down, bringing that fasting glucose down is important for reducing the risk for developing additional obesity-related diseases if they don't already have those. Even with our behavioralists, we have goals that are psychological goals. We want to see patients' self-esteem increase. We want to see their overall well-being increase. So we work to maximize patient safety through the medical monitoring part and to maximize total patient wellness through the behavioral part. Moving forward, I can't stress enough how we say medically supervised programming is the way to go, because we offer an assessment at the very beginning with one of our providers to go over the program and to go over their medication regimen and to make sure that they understand they're making a commitment to a weekly clinic visit so that we can monitor both portions of that program and also to meet with the dietitian regularly. So when they come in every week on Thursdays, they're going to see a provider, they're going to see a nurse, they're going to see a dietitian, and then on another day of the week, they're going to visit by phone with a behavioralist. So we feel pretty comprehensive about that. Their weekly clinic visits are going to be 30 to 45 minutes, depending on how long they need to visit with any of the staff here. And I can't emphasize the registered dietitian support enough. They're going to be asked to track their weekly input even while they're on a regimented 6-product protein diet, and all the way through helping them to understand that food tracking for them may be a lifelong habit that's needed. Education is very important. To arrive, we encourage them to arrive at their scheduled appointment time. They have plenty of time to meet with each individual staff member as they need to. And we're always available to answer questions through the week. Our product information is important for them to understand. We do provide 100% nutrition for their first 4 weeks, but we also really encourage a multivitamin and a probiotic. They can purchase those things through our office, or they can continue using something that they may already use. In terms of the protein replacement part, we have a shake, a meal replacement shake that we offer. It comes in a powder form. It's 27 grams of protein, 8 grams of fiber, only 170 calories. They can mix that with water and ice and kind of make a slushy out of it, or they can add an almond milk or an oat milk to that and really stay within the calories. They come in some nice flavors from a cafe latte, deep chocolate, banana berry, those kinds of things. So we like the variety that they can choose. They choose 21 products of those each week, 3 a day, so that they're getting a minimum, okay, of 100 grams of protein a day. All right. The second thing they get to choose is 3 additional products. So they've got 6 protein shakes, then 3 additional products. We like the variety in bars, and we have some chips, some savory snacks for the crunch that sometimes those that are drinking the shakes miss out on. They come in several flavors. They're also high in protein, but a typical regimen for that MAP patient on a daily basis would be 6 products, maybe a shake in the morning, a bar mid-morning, a shake at noon, maybe a snack in the afternoon, like a bag of the barbecue flavored protein packed chips, and then another protein shake for the dinner hour. And also then they've got a bar or half a bar left at bedtime, so they get some good protein to take them through the night. Total of about 1,100 calories at the most for a daily calorie intake. Lots of water, 64 to 100 ounces of water is what we also recommend. You probably know that with a high protein diet, there's a risk of some constipation there. And we are proud that the fact that our products contain a high amount of fiber. So we kind of avoid some disgruntlement that way. The patient's weekly transition moves them to 4 additional weeks of transitioning to table food. We take away 1 shake and 1 snack so that they may only have 3 or 4 products a day. And then we're adding a lean green meal wherever they want it in their day. So if they might want a broiled chicken breast of 3 to 4 ounces, they might want a 3/4 of a cup of broccoli, they might want a salad with a low calorie dressing. We're encouraging them to take the protein and carbohydrate levels of the protein product that they have been on and translate that with the dietitian's help into products that they can now purchase on their own. And that's really a celebratory time for them and their families, because we do encourage them to go ahead and have their shake with their family and their evening meal. But when they can sit down and enjoy then a table meal with their family, that's a really a cause for celebration. Often we encourage them to begin that transition doing 21 products a week now instead of 42 or 3 a day. And then we transition down to maybe just 1 product a day, 1 shake that they're doing at the end of the program. And they fully, with the dietitian's help, translated to a very healthy table food and grocery list by the end of our program. Our program may be, you can sign up for 8 weeks, 12 weeks, or 16 weeks. And the first 4 weeks are always that supplement protein regimen. Then the last 4 weeks of any program are always a transition into table food. If you're doing the 12-week program or the 16-week program, then you're on that food supplement program for 8 or 12 weeks. We individualize that, and of course, our provider in the program always helps that patient know exactly what their needs are. And that may mean that they sign up for 8 weeks and they get going, they're doing remarkably well for 4 weeks. And so they say, you know, I know I only signed up for 8 weeks, but I'm doing so well and I'm really enjoying my progress. So I'm going to extend my program to 12 weeks, continue on that protein product for another 4 weeks, and then transition. We really applaud their courage to do that because it's a major lifestyle change for them. And we applaud the fact that they're in tune with themselves, with the behavioralist, to know that, boy, I need to stay on this a little bit longer. So again, very patient focused. The cost for that 8-week program begins with their first assessment day with the physician or provider, and that is $192. And that jump starts their program by paying for their first office visit and their product for the first week. Most of our patients do a payment weekly or monthly in that program of about $200 to $250. And the medical cost for that total program is $1,485, but the medical portion can be used out of their health savings account, which is about $841 that they can get reimbursement for. We give them documentation so that they can be reimbursed. The estimated product cost of that initial 8-week program is about $645, and that's certainly not reimbursable through their insurance coverage. We would like to let you know we appreciate greatly your referrals, and keep them coming. If you have questions, don't hesitate to call our office at 515-358-9400. Most anyone that answers the phone, be it dietitian, be it our administrative assistant, or our nurses, can answer most any questions that you or your patient might have. This, we know, is a wellness journey. And again, it takes a lot of courage for people to come see us. And we do everything we can to make them comfortable, because this is a journey, not a destination. Thank you again for your interest, and we appreciate the camaraderie at MercyOne with you. Thank you, and have a good day.